I am excited to make contributions to the multidisciplinary approaches to Parkinson's rehabilitation in Ghana and how collaborative pathways to care can be adopted for better outcomes. Many times, nutrition is overlooked in the clinical setup. Before this meeting, I talked to some of my colleagues in the clinical setting, and they admitted the fact that they are not consulted on uh, rehabilitation of Parkinson's, and not just PD, but other chronic conditions as well. And mostly rehabilitation is limited to medical interventions. At least Dr. Goriwo mentioned that physiotherapy is being used in management of PD. From Ms. Abi's presentation, we also learned that, they are involved in the rehabilitation as well. And taking nutrition out is definitely not the best approach, or taking any other expertise out is definitely not the best way to go. So like the football team, rehabilitation of PD, among other chronic diseases, requires expert collaborative network in its
Our slides
rehabilitation.
are not moving. Okay.
Okay, so can you see my slides now?
Yes, yes.
All right. So why do we talk about nutrition? So imagine you go to the doctor's consulting room, you are bracing yourself. Why? Because probably in the past weeks, months, or years, you have subtle, frustrating movements in your body, your muscles feel locked. Our two resource persons have already told us some of the symptoms. So you feel slow when you try to stand up, you have these funny symptoms, and you are thinking about brain issues. You are completely lost because you want to understand what is happening. And we know that once you have issues in these directions, you are thinking, do I have a brain issue or what's happening to me? Then your specialist begins to ask you questions about your bowel movements, whether you've been bloated, what you have been eating, and you are completely surprised because you expect, something different. And this shows how important nutrition is. Because if you are talking about bowel movement, it's definitely what have I eaten? What can I do to, improve the situation? When we talk about bloating, you are still thinking what you have eaten. So it's important for us to review the current rehabilitation protocols while nutrition is overlooked. Yet it cannot be overemphasized that integrating targeted, culturally appropriate nutritional interventions in PD rehabilitation can mitigate symptom severity, it can optimize medical efficacy, it can significantly improve functional independence for Ghanaian patients. So this leads us to the gut-brain axis. The gut-brain axis is a network between the gut and the brain. And we'll briefly look at the pathophysiological foundation that runs through the gut-brain axis. So pathophysiological refers to the functional, physical, and chemical changes in the body that occur as a result of disease or injury. And anatomy, we know for the medical field, we talk about anatomy a lot, and anatomical pathways exist. So the scientific study of physical structure of living organisms. So recent developments in research evidence suggests that PD begins in the guts. Everybody talks about the brain, but development suggests that PD begins in the guts, and this is evidenced by neuroinflammation and dysbiosis. So neuroinflammation is an inflammation response within the brain or the spinal cord, and this is primarily driven by resident immune cells. So while it serves as a protective mechanism against injury or infection or toxins, chronic or excessive neuroinflammation is a major driver of neurodegenerative diseases, and PD is one of them. So we have the alpha-synuclein, which is an abundant neuronal protein, which is crucial for synaptic vesicle trafficking and also neurotransmitter release. In its healthy state, it is unfolded. It is an unfolded monomer, but in a neurodegenerative disorder like PD, it misfolds and it aggregates into toxic clumps known as Lewy bodies. Dr. Goro mentioned Lewy bodies. And when you take the gut, the enteric nervous system is usually referred to as the gut brain. So it also operates like the brain. And so once these Lewy bodies are formed, we have the vagus nerve, which connects the gut to the brain. These Lewy bodies, when they are transported, is like a ripple effect. They are transported to the brain, and then it causes the progressive loss of dopaminergic neurons in the brain. And so that's how PD progresses. So what are the nutritional challenges we can talk about? There is medication-nutrient interactions. The common drug that is used for treating Parkinson's is levodopa, and the prime is a primary medication. It competes with amino acids, which is the smaller unit of proteins from dietary proteins. They compete with proteins for or amino acids for absorption in the intestine and transport across the blood-brain barrier. So poor timing of protein consumption may therefore reduce the effectiveness of the medication and contribute to fluctuating motor symptoms or off periods. There is also the issue with dysphagia. Miss Abbey talked about dysphagia. It's weakness of the pharyngeal muscles, which increases the risk of aspiration pneumonia, and this can lead to mortality among individuals with PD. Ms. Abbey also mentioned aspiration pneumonia. It's a lung infection which is caused by inhaling foreign substances. So when food, I mean, we've heard about choking, not being able to swallow properly. So when food, liquid, saliva, or vomit goes into the airways, this can happen, and it happens when there is difficulty in this direction. Then we also have gastrointestinal dysfunction. The autonomic nervous system impairment commonly results in constipation and delayed gastric emptying, which can cause bloating, early fullness, and decreased food intake. When we talk about the autonomic nervous system, we are looking at the part of the peripheral nervous system that controls unconscious involuntary bodily functions. So the heart rate, the digestion, respiration, and temperature regulation. So we can talk about the sympathetic nervous system, which triggers fight or flight, and the parasympathetic, which has to do with rest and digestion. So those details, I would not go into it for now. Then we have sarcopenia. Sarcopenia has to do with reduced a loss of muscle as a result of reduced mobility. The more you exercise, the more you build muscles. And with this stage, when there is bradykinesia, where they walk slowly, everything is slow for them, that contributes to progressive muscle loss, and that worsens balance problems and instability. And that increases the risk of falls as well. And there is also increase, they move a lot. There are tremors and all that, even though they are slow. When they have movements in some parts of the body, their limbs, there is increased metabolic rates. And so it's also calls for some increased energy needs. So while we are looking at moderating proteins or watching the timing of proteins, it's important for us to also note that they require optimum amount of calories. And all these challenges diminish their ability to participate in physical rehabilitation. So there are some nutritional interventions. Integrating nutrition into PD rehabilitation requires evidence-based strategies that are adapted to the local context, because we can always hear about some dietary recommendations that have to do with Western diets, but it's also possible for us to adopt these diets in our local context. So we have the MIND diet, which is a combination of the Mediterranean diet and the DASH diet. The MIND diet is suggested to reduce oxidative stress. Oxidative stress is an imbalance between unstable molecules. We commonly call them free radicals. So when there is an imbalance between these free radicals and protective molecules in the body, oxidative stress can result. The free radicals can outnumber antioxidants, which are supposed to protect against some of these conditions. They damage cells, proteins, and DNA. They contribute to immature aging. They contribute to inflammation and chronic conditions like heart disease, cancer, and neurodegenerative disorders. So the Mediterranean diets, it's a heart-healthy eating pattern. It's based on the traditional culinary habits of countries bordering the Mediterranean Sea. It emphasizes plant-based foods, whole grains, and healthy fats. So we have our olive oils, and is strongly associated with a lower risk for cardiovascular disease. And then we have the DASH diets. That's the dietary approaches to stop hypertension. It is scientifically proven that eating the DASH diet helps to lower blood pressure, reduce cholesterol levels, and also help prevent chronic conditions. It focuses on nutrient-dense whole foods rich in potassium, calcium, magnesium, fiber, while severely restricting sodium, saturated fats, and added sugars. I must say that there are foods that deteriorate the conditions. Dr. Goro mentioned that, I mean, she has seen patients who have survived many years without having their situation deteriorate at a faster pace, and others have not survived. I believe that it boils down to the intervention, and I believe she can also testify to the evidence that when the appropriate interventions are put in place, these will help to reduce the retrogression of the condition. And so there are key nutrients that we would want to pay attention to. We have the antioxidants, vitamins A, C, E. Vitamin E in particular has been shown to contribute more to neuroprotection. And vitamin D also addresses deficiency. Omega-3 fatty acids also help with anti-inflammatory effects. And I must also add that we should be mindful of supplementation, food supplements or nutrient supplements. Although we are saying that they need some nutrients, we shouldn't jump and be administering supplements to such patients because they can also affect them adversely. So as we are talking about the DASH diet, the Mediterranean diet, the MIND diet, we should be mindful because we believe in individualized nutrition, personalized nutrition. People have different needs. So two people suffering from Parkinson's does not mean they're going to consume the same foods. We will have to assess them and determine whether we are going to give them a particular combination of meals. So there are beneficial foods as well. We can talk about soy, which contains genistein, that also helps protect or improve the situation. There are isoflavones, which are phytoestrogens that also help caffeine. Evidence has shown that caffeine may lower onset risk. And then most scientists would not like to talk about smoking has also shown to lower the risk, but you don't want to encourage people to smoke because there is also evidence to show that smoking is associated with heart diseases. So that is a no-no for the rehabilitations, but I thought I needed to mention it as well. And then we have the microbiome. I've already talked about the gut-brain axis. And so it's very important that we have a healthy microbiome. And we can talk about taking yogurt, but how many probiotics do we have in yogurt? And talking about yogurt, for the kind of yogurt you are taking, what probiotics do you have in there? And will these probiotics help to improve the situation? So it comes down to investigations on what the microbiota, even for the African population, looks like and how it can help or not help the situation. So macronutrients, I already talked about proteins and the fact that amino acids will interfere with the absorption of either the medication and also the nutrients. So it's very important we mind the timing of the administration. So what is recommended is that the medication levodopa is taken 30 to 60 minutes before meals and usually during daytime, so that during daytime the focus would be on carbohydrate-based meals, and then in the evenings a relatively high proportion of proteins can be taken. And this is why expect rehabilitation is necessary, because the high here I should have put in quotes or I should have highlighted. High doesn't mean you just give any high quantity at all. It must meet the need, the nutritional need of the patient that we are dealing with. So healthy carbohydrates means they are taking whole carbohydrates. They are taking healthy fats like olive oil, monounsaturated fats, and the way we cook our meals. Should I say our traditional way, or we fry our oils, and at the end of the day, we destroy the healthy benefits of the oil. So it's very important that we mind how the food is cooked as well. So that's an important bit. So the management of non-motor symptoms as far as nutrition is concerned. So we can talk about the texture of the food. We have our local foods, our yams. We can mash it, make it soft. We have Tom Brown, a mix of diverse cereals. We have rice soup, which can be mixed with fish powder. So the way in which we can prevent the choking and aspiration anemia would be to help the patient sit upright at 90 degrees. And then they also remain seated for about 30 minutes so that we can have the food sip down the guts. And then it's very important as we talk about the microbiome, it's very important to talk about fiber as we also talk about reducing constipation that has been mentioned in previous presentations, and then adequate amounts of water intake to prevent dehydration. All that is important. And then as we're talking about weight loss or sarcopenia, which is a loss of muscle, it's important to boost caloric intake, so the healthy fats and even the physical activity that the patient can engage in will help the situation. So there are indeed challenges. There is the multi-journey. For example, we likely have centers at Kolebu and Konfanochi in Kumasi. So we have someone suffering who is in the north, someone in some village somewhere. They have to travel hours to get to the health facility to have this management. They already have problems with movement. They're already struggling with eating, swallowing, and then we have to put them through the stress. That is definitely worrying. And then cultural stigma, cares, supernatural causes. When you are suffering from such a condition, people don't want to get close to you. People are associating it with cares, or they think that it's a spiritual problem. Some people may end up, especially people who are not exposed, may end up in some prayer centers and all that until the situation gets worse. Well, if they get a miracle, hallelujah. But these are real challenges that we see. And then lack of expert collaborations in rehabilitation. My colleagues in the clinical setting have testified to this. And so we need a multidisciplinary team for future directions, the neurologist, the dietitian or clinical nutritionist, the speech therapist, physiotherapist, the caregiver at home, very important, who has to be coached as well. All of these expertise are necessary, and the goal is to enhance functional ability, to minimize disability, and also to improve the overall quality of life. So what innovative solutions do we have? And I had the opportunity to engage with Mr. Alfred Oforiajiman of the Institute of Traditional Alternative Medicine, who shared some insights on some research that has been conducted in this area. And then we have velvet beans, which we are lucky to have in our own country. And it has shown to improve the situation of the PD, the progression of PD. And I think that it's important that research, we begin to engage in research that looks into what we can use locally. Then community-based rehabilitation, training community health workers and local nurses to identify malnutrition and deliver basic dietary advice tailored to PD. This is vital. This is very important. Then tele-dietetics, utilizing mobile health platforms to provide remote nutritional counseling and monitor patients' weight and medication adherence. And this can bridge urban-rural divide that currently exists. Then we have protocol integration. The Ministry of Health and the Ghana Health Service can formally integrate nutritional screening protocols into standard neurological outpatient care. And then health insurance coverage. I don't know how much health insurance covers PD condition. There are vulnerable groups among our population who need this kind of insurance coverage. So in conclusion, nutrition is not a peripheral adjunct to PD rehabilitation. It is a foundational pillar in Ghana, addressing the complex interplay between Parkinson's pathophysiology, levodopa pharmacokinetics, and nutritional status is essential for improving patient outcomes. By adopting global dietary guidelines to local culinary traditions, integrating dietitians into the neurorehabilitation team, and leveraging community-based healthcare models, Ghana can transform the trajectory of Parkinson's care. And people might say that, oh, the condition is not common, but there's also the literature that suggests that people in sub-Saharan Africa may be underdiagnosed. So there are people suffering underdiagnosed or misdiagnosed. So there may be people suffering from the condition, but they may not have been diagnosed yet. They may not have been identified yet. So sustained advocacy, localized research, and health policy reforms are imperative to ensure that every patient has access to the comprehensive life-enhancing care they require. The intersection of nutrition and PD in the African context remains severely under-researched, and future priorities should include longitudinal studies assessing the efficacy of indigenous Ghanaian diets on PD progression, the development of localized clinical guidelines for neuronutrition, and investigating the specific gut microbiota profiles of West African PD patients to develop targeted region-specific probiotic interventions. These are some of the references that were used for developing these slides, and thank you. I have these pictures on just to show that our local foods can also be used in the management. We can combine them as a mind diet and we can use it for managing the condition as well. Thank you.
Thank you very much. Let me thank you for that great delivery. Please carry on.
All right, you're welcome, and many thanks to you as well. So, well, it's humbling to have some of our colleagues on here. We have Dr. Frank Apiakusi, who is with the School of Sports and Exercise Medicine at the University of Health and Allied Sciences. He's greeting us all and he's thanking Dr. Goyu for the insightful presentation. My question is, you mentioned dancing being significant in PD management. You clearly indicated study is yet to identify any Ghana dance. I think there is a lecturer who teaches dance at the University of Ghana. Perhaps you can consult him for this. So during the ball throwing exercises, do you think a suitable music background to the throwing would help if patients can nod head or shake their body while throwing and having some dance to it? That sounds interesting. And he's also asking, he's also asking again, is this hereditary? Maybe you touched on it. Okay, he's asking, is it hereditary?
Yeah. Okay, thank you, Dr. Apia Kusi, for that question. You are very right. The throwing and catching of ball, we could have music in the background to make it more fun, but we will not recognize that as dance therapy or dance exercise because the focus is on the throwing and the catching of ball, which may focus on something else. In as much as the dance can help with balance, stability, and all, the throwing and catching of ball also helps with coordination, keeping eye contact, improving reaction time, and there are a whole lot of other focus on it. The music in the background will be an add-on. But if we really want to explore the benefits of a particular dance to Parkinson's, like we have proven with the Argentine tango dance, then we can do something like that. So for instance, we can take our Azonto moves, maybe specific moves within Azonto, and teach our patients how to carry out those moves with some targets in mind that we want to improve gait parameters, we want to improve hand movement during swing, and we want to improve stability and balance. So we are targeting Azonto moves. Or if there are other traditional moves, the Adowa Ketes also. In fact, our Ghanaian dance have so many gestures in them that I believe will be very relevant depending on which part of Ghana a patient might be coming from. So that is really something in my bag that I have to deal with. And like Helen said, the lecturer in UG who is on the social media everywhere is one of my targets. to actually see how best I develop that, since he has the knowledge in the dance and can make significant input there. So for sure, we will be seeing something like that in future. Adding the dance in the background to the throwing and catching of the ball will be very great in terms of the exercise. Now to the hereditary bit, yes, you missed this because Parkinson's has genetic roots. So we say we have genetics coupled with environmental exposures. And that is mainly in those who are within the young or the juvenile onset. Majority of them have the genetic component in there. So they are inheriting the Parkinson's genes from their parents or grandparents. I've come across some writing that a mother who is, I think, 70 years with Parkinson's, and the daughter who is 40 years has also been diagnosed with Parkinson's. So mother and daughter, both Parkinson's. So it's very clear that she having her Parkinson's at that early age and the mother having Parkinson's at 70, or and it was diagnosed earlier, clearly tells us that there is a hereditary link in there. There is a gene that is causing that. So yes, indeed, there is hereditary processes involved in some of the Parkinson's disease. Thank you. I hope this settles your question.
Hopefully. I think you'll give us a thumbs up if we've done justice.
Yeah.
Nana Junior says, thank you, Dr. Goro. Pertaining to the management, what's the role of the family in caring for a person with PD?
Okay. Thank you very much. I believe in all three presentations, there were mention of partners, family here and there. Family is actually very central. And in my concluding slide, I even did indicate that engaging in physiotherapy does not only improve the function of the patient, but also the welfare of the family, because they are very central in terms of managing this condition. Don't forget, this is a chronic condition. It has no cure. And to top it up, it is progressive. So the condition is going to worsen gradually with time. So managing it, we keep the family very focal in it, in terms of medication management, in terms of all rehabilitation approaches. I made mention that the physiotherapy and all other rehabilitation interventions, one must be consistent. And the consistency is not just one-off kind of thing. Even when the patient comes to physio department and I take the person through any form of exercise, I expect continuity at home. And that is where the family will play that critical role, because you will teach them what the patient is expected to do at home. So they now become the home therapist to guide and support the patient to carry out those interventions. So we can't be talking about rehabilitation or managing Parkinson's disease without the family member or the care partner in the picture. They are very important, and let's never forget to keep them in the loop. Thank you.
Ah, thank you, Doc. You see why and how I have sighed. Dr. Apia was to bring trouble. So he's asking again. You'll understand me when I read. He
I
says, do
do.
you think sports and exercise medicine can play any role in PD management?
Okay, so my simple answer to that is a yes. Currently, we have this intervention we call walking football, and it has really been used among persons with Parkinson's. It's playing football normally, but for persons with Parkinson's. So you don't run to kick the ball, it's purely walking. I know FIFA has not yet provided any guiding rules for that, but we have our own guiding rules that we don't run to kick this ball, we walk to do it. It has really been used in the UK. We have one lady who came down to Nigeria to organize that walking football with Parkinson's Africa, supporting the organization. We plan to have something like that in Ghana for our patients, but logistics, finances, things here and there has not really allowed us to carry that out. But the day we settle on doing walking football for our patients, I will not forget to invite Dr. Apiakusi to come and help us with some guiding rules from FIFA. I see you are their rep in UHAS, so you will help us with that. Thank you.
Definitely, definitely. So Nana says, kindly throw more light on the wet voice. And he also says, in the absence of a speech therapist in your facility, what are some of the improvised modalities that can be employed to assist in the management of a client with PD? I think this goes to Miss Abe.
Yes, please. Okay, so the voice is about the voice quality. So it sounds a bit raspy, kind of rough when you take in food or liquid, or when excess saliva pulls near the vocal cords and then some sip into the airway. So you feel like you should clear your throat again. Yes, that's how. So the quality of the voice changes. Yeah. Okay.
Okay, thank
Um,
you. I am.
and then some of the things that we can do. Okay, so in terms with dysphagia, what we can do is that we look at the consistency of the feed. You give the client what they are comfortable with. You look at good posture. They should sit upright. I think Dr. Inti also mentioned that when they are feeding. And then also we should also give them good oral hygiene, because it's the bacteria in there that will go down to cause aspiration pneumonia. So if we have good vocal and good oral hygiene, we know that whatever is going in there is safe. So we should maintain our good oral hygiene. And then we look at the consistency of the food, and then look at the bolus size. If they are comfortable with a smaller size, the bolus size, we work with that. And then with the speech, we also encourage our partners, the communication partners, to face the clients when they are talking to them. And then you encourage them also to speak louder. You can give them options. So for instance, if it's maybe food, do you want to eat rice and stew? Or do you want to eat rice or banku? That's very simple. So that one, they'll just give you a straightforward answer. They'll just choose one. So we give them options. Yes. And then you allow them extra time. Give them some time to respond to whatever question or whatever you're talking about. Just give them a bit of time. Yeah. I think that is it.
Thank you, Miss Abe. The next question is okay, very insightful presentation. This is from Raman. Very insightful presentations. Is there potential for group exercise interventions for better outcomes for people with PD? If yes, how is that feasible in Ghana, where most patients are hesitant in sharing their disease conditions with others, coupled with a lack of peer support groups? Dr. Agoriwo, from your long-standing experience in the management of PD, I would be glad if you could share briefly your experience in using group therapy interventions for people with PD.
Yes, thank you very much, Sedu, for your question. In terms of group interventions, certainly there are some literature to prove that um, undertaking physiotherapy intervention in groups has some form of significance over an individualized session, especially when it comes to social engagement and improving the person's interaction with others, engaging and meeting people, sharing ideas and knowledge and all that. Yes. So certainly on that social grounds, these group interventions or group exercises are very, very important. In terms of the practicality of it, I have used group exercises in my practice as a physiotherapist with persons with Parkinson's. I used to book my patients together, like a number of patients on the same day for that purpose. So when they come, um, depending on their specific challenges, and then we see the common challenges that they have and see what intervention can all of them be involved in. And one of intervention I have used mostly is the gait training or gait retraining, overground walking. You saw the way I did with the man in the video, how I had to take him step by step. Something like that, you can't possibly use group exercises to achieve that because the person might be left behind. But when you have people who are able to walk and swing their arms to some extent, then you can put them together. We have some music in the background or some rhythm in the background. Then we do like we are marching towards a particular point, we turn and then we come back. My colleagues in Kolebu that I worked with years back know me for this. I do group exercises and then I do individual interventions. It is very, very feasible and easy to do because they are your patients, you know them, and you know how to book them so they will come together and then they do it. And then you can also see the throwing and catching of the ball that I showed. For the two who were standing, they were both patients. So that's a form of group activity. And there are times where I put three patients together to do that throwing and catching. And those who were seated to were two patients doing that. And it brings some kind of fun to the exercises that they do. So it is very, very feasible and very practical to do. There is an extension of peer support groups, yes. So I am also a coordinator for the PD support group Ghana. It's a Parkinson support group that is based in Accra here. It was founded by a person living with Parkinson's disease. I got to know them when they invited me to come and take the group through physiotherapy sessions for persons with Parkinson's. I think that was somewhere 2016. And since then, I have remained with them. So now I serve as a coordinator, ensuring that the group meets every Saturday, first Saturday of the month. And then we go through a lot of activities like we have described here. Managing Parkinson's requires a varied group of professionals. We bring the psychologists, we bring the dietitians, the speech. We even brought someone who facilitate this walking football to engage my people. And they were very excited to be involved in it. So there is a Parkinson support group in Accra here. We also have one in Sugakope and Richard Novati Catholic Hospital. We have started one at Sola Tuna Kalba. And so that is in the Savannah region. We have supported one professional there, nurse, to start a support group like that. So the support groups are there. If you need to refer anyone, just reach out and I will provide assistance. I hope I have tried to address your question. Thank you.
You have tried. Dr. Apia says, thank you, Dr. Inti, for the insightful presentation. He said, please, is there any local food you can suggest which may help with dopamine increase? It may sound a difficult question, but just want to know if there are any so that Dr. Agoru's work may be easy. PD is worrying after listening to you all. Dr. Apia is worried about you, Dr. Aguero. So when it comes to diet, definitely, like I answered in my conclusion, yes, we can adopt these westernized diets, the neuroprotective diets, where we talk about the mind diet. It's mainly fruits and vegetables are dominant. But for the vegetables, we are looking at colored fruits and vegetables. So you have the berries, you have, for instance, if we come to our local setting, when we are talking about fruits, we can talk about watermelon, we can talk about pawpaw, we can talk about these citrus fruits that can help boost immunity. Foods that are rich in antioxidants, cabbage, cauliflower, we have them in Ghana here. We also have learned about the velvet beans. So these foods can be used. They are local foods. Our kontomire, our boko boko, our greens, the greens, fish. We have fish. Like I said, when we say fish, it means that the fish has to be steamed. When you fry it, we've lost the omega, the healthy fats. So aside the food variety, the diversity, using the colors, the diverse colors of the foods to be able to help tell, which would provide more antioxidants. It's very important for us to also pay attention to how the foods are prepared. Of course, we will have to stay away from fried foods, foods that are rich in butter, red meat, fatty foods, etc. Um, basically, uh, I hope I've
Okay.
answered you as well. Someone said the slides are not showing. I hope my slides show to the end.
Yeah, your slide showed to the end. This is question and answer session, so no slides are
Okay.
showing. But just to
Right.
add a little bit to what you have said, looking
Mm.
at Dr. Apiakusi's question closely and about food that may help with dopamine increase. So, dopamine increase. I have not come across any food specifically that one will eat to increase dopamine levels in the brain. However, I know that exercises help to enhance dopamine function within the brain. The little that the brain cells remaining, the dopaminergic cells remaining, are producing, and then the medications that are taken actually convert into dopamine. The levodopa based medications convert into dopamine to supplement what the brain cells are able to produce. So when one exercises, it helps to retain the dopamine within the brain cells for a longer duration. So it enhances its function. And then also it reduces the rate at which the dopamine depletes. It's a cycle. So the cells produce, the dopamine is being used, it depletes, and the cycle continues. So exercises have shown to enhance dopamine function by prolonging its stay within the brain and then also reducing the rate at which it depletes. So that's what I can say with regards to exercise. In terms of the food, maybe the purine, mucuna purines that Dr. Inti mentioned, that is our local beans, the one look tree we call apia. It's very itchy if it touches the body. And that has shown to, it has levodopa, let me put it that way. Yes, just like the levodopa based medication. This is a natural bean that has been found to contain levodopa. I remember someone asked a question whether they can cook the beans and eat in anticipation of Parkinson so they can prevent it. But no study has supported that you can cook the beans and eat and it will enhance your levodopa or increase levodopa in the brain. That has not yet been confirmed. So that is what I would say in terms of increasing dopamine within the brain. I hope I've tried to also add on to
You
help.
tried. You tried. On top of that, and what I had shared earlier, I think with the pathophysiology, it comes to the guts. So, what foods will improve the gut microbiome, the microbiome? Because we are saying that once there is neuroinflammation, dysbiosis, it means that, these Lewy bodies are going to be formed and are going to go across the vagus nerve and are going into the brain and are going to deplete the dopamine. So if we are going to prevent that, it means that we have to keep a healthy gut, and it comes down to fiber intake, the antioxidants. So we look out for such food, soy as well. Yeah, so thanks. Mr. Alfred says Thanks to the presenters, with the multi-team approach, PD clients can be better managed, definitely. And Dr. Esther Mwogu says, very insightful presentations. Thank you. Thank you all. Thank you all for your participation. We are very grateful for joining us and for your contributions as well. I think that it's been a very interesting sessions. If there are no further comments, Dr. Goro, any comments,
Oh,
additional comments or
okay. So
conclusions?
I will also want to thank our participants for staying through up to this side, this time. I
Right.
see a number of my colleagues in the participants list. Dr. Vivian Della Ampo is here. I see Dr. Esther Inwo. Am I getting the name right? Yes, she's also with the speech, yes, department. I see Madam Mercy Nketia, my senior colleague from Tema General Hospital. Seidu is also my colleague. And then Peter, yes, I see you as well. And all others that I did not mention your name. I'm very, very grateful for the support. And the team is happy that you join us to learn from one another. Thank you very much.
Thank you. So we will all meet on the other side. We are very grateful. God bless you and enjoy your weekend. Bye.
Have a good night. Bye.